Welcome to the Becky and Boca Show, coming to you every Thursday night from downtown Boca Raton. And tonight I have a guest that I have he's been on my radar for quite some time. It's Dr. Gregory Albert, and he is a plastic surgeon in Delray Beach, correct?
Correct. Delray Beach, basically Boca Raton.
Okay, and the reason that I have been after you is I have seen a lot of your necks around town. A lot of women with nice, tight necks. Mm-hmm. And that's the number one thing that women ask me about is the necks. Everybody, like, what can I do about my neck? What can I do about my neck? And I had Siggy Flicker on here last week, and she told me that you did her facelift. And the reason she went to you was she saw some beautiful necks around Boca Raton. So you're my neck guy as far as I'm concerned. Can you tell me, is there a minimum type of surgery for, like, if I wanted to tighten up my neck that isn't a big deal?
Yeah. So I think you hit on the point about the necks. I mean, the necks are so important. I mean, just, men and women. But
yeah,
there's
this
not
whole droopy thing under here.
Yeah, especially in Florida, we have sun-damaged skin, and so necks start to age a little bit quicker. And then with genetics, mostly guys, but also women just happen to have full fat necks.
Yeah. And there's nothing worse.
And there's not a lot. There's not a lot of non-surgical things that make.
I think I've tried all of them.
A real wow result.
They make a difference.
Right.
I did a laser neck lift, and that made a difference because I used to have a lot of stuff under here.
Right.
And then I did all therapy, and that made a bit of a difference. But I'm just wondering if I should have skipped all that and done some minimal surgery.
Well, yeah, you hit on a lot of the named things. There's thermage and there's laser and all therapy. All therapy and thermage are non-ablative things where they don't touch the skin on the outside but tighten underneath. And then laser is more of a tightening depending on what kind of laser it is. But the laser will actually tighten the skin on the outside as well as on the inside. So that's a good procedure too.
They just did a laser on the inside, put a little hole under my ear and put the laser
similar,
in here. And then they liposuctioned out the fat too.
Right.
So it did help with that, but I still have the,
correct.
loose.
There's a new procedure that's relatively new called Kybella, which is non-surgical, which is injections, which is great, but it doesn't address the skin.
I was wondering about that. If you inject that into your little fat pocket, don't you have the saggy skin remaining afterward?
It could happen, and that's why everybody's not a candidate.
Because some people have told me that it tightens the skin, but I don't know how that would work.
It doesn't tighten it. And that's really the thing about necks. There's nothing much that tightens the neck like surgery.
Right.
Because you can't take or tighten, let's say half an inch, let's say a quarter inch of skin, which is if you just kind of just pinch on your, that's about a quarter of an inch. There's no machine that's going to be able to shrink it significantly enough that's going to make a dramatic result.
Right.
So surgery is really the only thing to do if you have skin that's kind of crepey, to treat it,
Okay, if you were going to do a neck like mine, what would I need? Because the women ask me all the time, what can I do about my neck?
Great
but they
question.
don't want the big major whole facelift.
So that's a great question. So there's a kind of a time in life where, let's say 40 to 55 or 60, but really in the 40s, we're talking women right now, that are candidates for neck lifts. Because after that, really, to do it right, to really match harmoniously the middle part of the face and the neck, you need to do a face and neck lift.
So Siggy told me that that's what you did on her, a lower face and a neck.
So on Siggy, I did an endoscopic mid-face lift, which I'll describe in a second, and then a face and neck lift. Okay. So when I do the endoscopic mid-face lift, I do a small incision in the temple, and I use an endoscope to dissect the cheek and then lift the cheek. And so it gives this nice full cheek that women want.
Are you putting fat in there or anything?
No, it's their own fat. The great thing about the endoscopic facelift is it gets 100% of the fat lifted up into the cheek. So endoscopic,
you mean you're not cutting like you would for a normal facelift?
Correct.
Okay, so what are you doing exactly? You're just putting...
So I'm lifting... So the face is basically made up of some fat, muscle, and fat and fascia. A regular facelift is in the part above the muscles and just lifts that fat. There's about 40% of the fat that above the muscle part. And so with a traditional facelift, that's what it lifts. Okay. But with a mid facelift, I can't say 100% of the fat, but I'm lifting that whole entire thing.
So it's even better.
Whole entire mound up to the cheek. And so it makes a really nice dramatic result in the eyelid to cheek, and it really makes a nice framing of the eye that you just can't get with a regular facelift.
And is this less invasive than a regular?
It's less invasive because there's no incision that needs to go around the ear in front of the ear.
I like this. Okay.
Problem
I did not know
is
about
that
this.
the one downside is that we have to know how to do it right.
Right.
But it's not meant for patients who also need tightening of the skin for the face. It doesn't, because for that you need to do the other facelift.
Okay,
you need to cut the skin out.
And it's not going to lift hair.
Correct. And that
Okay.
was the other thing.
Okay. So and Siggy, you did a mid facelift and a neck lift? Is that what you're telling me?
Correct.
Okay.
So the way you think about it is the face is kind of third. So the forehead's the upper third. The cheek is the
And
middle.
you did nothing
middle
on her
third.
up here, right?
I did a brow lift on her as well.
okay. Okay.
And then the neck is the lower third. And so someone in their 40s who just has sagging in the middle part of the face, it's a great procedure in women who are not ready for a facelift because they can have the incision that's completely hidden. And you can consider it's basically a scarless facelift because there's no
Right.
scars in front of the ear. It's really good for guys. Some guys are concerned about the incision in front of the ear.
Sure.
And it's also good on patients who have had a facelift, but the mid-face or the cheek has not been fixed.
Okay.
Which happens a lot because there's
Yeah.
different abilities and there's different procedures. And so in Siggy, since she was on the younger side and she wanted that cheek fullness,
Yeah, she
which is
looks
nice.
great.
And that way we were able to make her eyes look better as well at the same time.
Okay.
And then, but since she did have the full neck and then extra skin, I also went back and also did the face and neck lift.
You did the endoscopic mid face on her, and
Correct.
then you did surgery here? Is that what you're saying?
Correct.
Okay.
At
And
this-
where did you cut down here?
And so she also had some skin. She was one of those combined procedures where she also needed skin from the middle part of her face lifted.
Okay.
So sometimes I'll do an endoscopic mid facelift to treat the face, and I'll do a neck lift, which is basically the incision behind the ear, and it just solely lifts the neck. A little bit of the jowl is kind of shaped.
Yeah.
But then really to get that more of a lifting and also lifting and improving the corner of the mouth and the jowl, that's why the facelift was done. That's the other thing, actually, that the endoscopic facelift does great. You'll see women, with the downturning in the mouth.
Yes.
And it is very
You can
powerful
use,
to do that.
filler
And
to turn that up a little bit.
Yeah.
That's what people
But
generally do. But so you can do that surgically.
Right. So with
Okay.
a regular facelift, it's more difficult to do that. It's not quite as
Oh.
dramatic. But you want the corner of the mouth to be neutral. You don't want it up.
Right,
I mean,
right.
obviously, we all think of the joke or whatever,
Right,
which
exactly.
is actually kind of difficult to
I mean, a
do.
lot of people that look like that.
It's difficult to do, but
But it's been done.
but it looks real. But the endoscopic mid facelifts in the right patients look really nice and natural.
Oh, well, okay. Now, what about someone like me? Would that be enough for me, or would I need more?
Well, you would need the neck would be.
Oh, I
you
know I need
you
the
need
neck.
the neck.
Yeah.
And then the mid face lift would be nice in you because it would lift that cheek, and it would
And
also
does it
help
lift this area
the
too?
corner of the mouth a little bit.
Okay. And what kind of downtime is there with this?
So downtime varies depending on age. Let's
So I
say
do the show
let's say
every Thursday.
Let's say it was you. So if you did it, if you could
I do it
have
on a Friday.
if you could have a week. Well, first off, you're in the beauty industry, so you get a little bit of a buy.
Okay.
Oh, I had something done. So
That's
it's a
true,
little,
and I can
a little
actually
more.
talk about it. Okay.
But in all seriousness, so a mid facelift would about 5 to 7 days. You would look. You would still be swollen. Mm-hmm. But
Are
most
you
of the
all
time,
bandaged up?
no, not
No.
bandaged at all.
Oh, really?
Yeah.
So you
So-
just walk out of there?
You might have a bandage when you leave,
Yeah.
but I don't make patients usually don't wear a bandage past the first couple of days.
Oh, that's amazing.
But
I had to wear this big thing just for that laser neck lift.
oh,
for
really?
for a while, yeah.
Patients do get bandages, but most of the time, after about a few days, it's one that they could put on and off.
That's nice to know.
So generally, visually, if I'm just doing an isolated mid facelift, you can go back to work after 3 to 7 days,
That's
depending on
wonderful
what you're doing.
because that's people's biggest fear is that they have to go away and hide for a long period of time.
Yes, that's not to say you're going to be
Looking great.
looking fantastic.
Can you wear makeup?
I mean, there's a
Can
possibility.
you put
of
makeup
bruising.
on?
Yeah,
Because
you
once
can-
we can put makeup on, we're good.
but you're not going to feel 100% after 9 hours of work. You know,
Yeah.
you're going to be a little more sluggish.
Yeah.
And it varies a little bit. So I tell patients, 5 to 10%, you're not going to look as presentable as what we're saying. So that actually may be, instead of 5 to 7 days, it's going to be 3 to 4 weeks.
Right, before
So
you really
sometimes
feel.
that happens.
Yeah.
So and that's what patients are.
But I'm
it's
just
so
talking about
important
the
to
part
inform
where
patients.
you can't even go to the grocery store, you can't go out. That's 3 or 4 days? Or
Yeah.
not even?
Correct.
That's pretty good.
Yeah.
Wonderful.
Yeah.
And is it general anesthesia or do you use
Good question. So we're in this era of patients not wanting to go to sleep. They have a fear of going to sleep with
everybody says
anesthesia.
that. Is there, now tell me the truth, is there more danger when you put somebody under than if they're doing like a twilight or something like that?
I think when you have a board certified plastic surgeon that fully evaluates the patients and picks the right patient, I think they're both equally as safe.
Equally.
Now, with the way I do it is patient, they don't want to go to sleep. They don't even want IVs, so I give them oral medications and then I numb up the areas I'm doing
You can do
surgery
surgery
on.
that way? Just oral medication and then...
Well, you can get pretty drowsy with oral medication.
Yeah.
But forget that for right now.
Okay.
But but they don't want to go to sleep. So a good surgeon who doesn't mind talking to patients and kind of explaining during the procedure.
They don't want to go to sleep because they're afraid they're not going to wake up. Is that there is a big fear of general anesthesia, and I'm just trying to determine if that's rational compared to the other types of anesthesia.
It's a great question, and I tell patients, when it's done correctly, they're both equally as safe.
Yeah,
I mean,
that's
general
what I assume.
anesthesia is incredibly safe.
Yeah,
IV
because you're
sedation,
monitored the whole time.
It's very safe. Patients nowadays, they want less for more. I think when we don't have general anesthesia or deeper sedation, I think you do recuperate a little bit quicker because you're not having that medication. But we're not talking weeks. Maybe a few days.
So wait, which one you recuperate faster with if you don't have general?
Correct.
Okay.
And it can be done nowadays. A lot of times. Now,
do you prefer doing it one way or the other? Does it make a difference to you? I mean, I would want to make it easiest for my doctor.
I like patients. I like talking to them for the most part. So I get to know them sometimes during surgery. So sometimes they'll talk.
So they'll be, the whole time you're working on their face, they're awake and talking to you?
Well, they'll doze on and off, but some patients do talk the
Do
entire...
they know what's going on? I mean, are they aware of where they are?
They are, and then they tell stories. They tell stories,
Yeah.
like if there's a hurricane, where would I, stash my money and stuff like that. No, but it's a little bit like Vegas. What happens in the operating room stays in the operating room. So there's a complete confidentiality.
Yeah.
But it's not.
They're awake, but they're not really aware.
They're awake, but they have it forgetful,
and they don't remember.
And they don't remember, which is a good thing.
Right.
So what may be a 3-hour surgery might seem like 3 minutes to them.
Yeah. That's a good thing.
And so patients desire that now, and I think it's
I know.
it's a
Everybody
safe way
asks
when
me
it's
if they
done
can do it without
correctly.
general anesthesia, and I guess the reason is everyone feels it's safer. I mean,
It's just as safe.
yeah, that's
But
what
certainly, if you have a doctor who's not well versed in the medications, not well versed in monitoring patients, it is more difficult to do because the doctor, the plastic surgeon doing the surgery, is also monitoring the patient too. So there's a lot of little things.
It's more
that you
difficult
need
to do it without general, is what you're saying?
for the doctor,
Right.
And that's why some doctors don't want to do it.
Right.
But I think the other thing is they don't want to have to worry about the patient talking, or they're not a people person sometimes.
Right.
They don't want to talk to them.
Yeah.
They want to
Put
go to
'em out.
sleep. And
I'll do surgery.
but I've been doing that for the last 18 years, and I like it. I enjoy the patients, and once in a while I have someone that wants to be a little too talkative. So
you
they
give
get
a little more than
they get a little bit
knock
more.
'em out.
So shorter procedures can be done at a local and not having to go to sleep. For instance, upper and lower eyes can be done.
Okay.
That's the way I do probably 97% of them.
Right.
Facelifts can be done. The endoscopic facelift can be done. Endoscopic brow lift. Smaller sites of liposuction can be done. I do lots of gynecomastia surgery as well, which is breast in men. Those do great under local
So what
anesthesia.
does that do? You're reducing the breasts in men? Is that
Correct.
okay?
So about 15-20% of guys get gynecomastia, which is breast, and it's troublesome.
Sure.
It can't fit in your
Especially in
clothes.
Florida when you're trying to wear a light glove.
Yeah, the shirts don't look right and everything. And I should have turned that off.
that's okay.
What a rookie move that was. And so those type of procedures are really great under local because the patients they're up and out, and
Right.
they feel great that night. I talked to them the night of surgery after they've had it done. 5-6 hours later, most are too talkative, and they say I feel like it's maybe their sister answering or something because I say, you sound too good. Did you just have surgery? So it's pretty neat nowadays. When
So you feel fine afterwards, where if you had the general anesthesia, you might be more tired
you
for a
might
while.
be.
Okay.
But then again, generally, I'm not going to say general anesthesia is bad or any other form of anesthesia, as long as it's fit with the patient.
Right. I just
and
think
they're comfortable.
people worry too much about that. They don't want to general anesthesia, but they want to get these procedures. So I was just trying to determine if that's a rational fear.
Yeah, and I go over all the differences with patients about that, and they just seem to be, they don't want to go to sleep anymore.
Yeah, I know. That's what everyone tells me. Okay, so on Siggy, you did, she said you did a mid-facelift and a neck, but you also did a brow. Was that part of the mid-facelift, or is that a different procedure?
So there's that's a good question. There's a little overlap, although you are the beauty expert, so.
Yeah.
So part of the endoscopic facelift is done with a similar incision to the brow lift.
Oh,
and so the
okay.
corner, kind of the lateral hooding of the eye, is lifted with part of the mid facelift, but also the brow.
Interesting. So it's two procedures you would do, this and then the neck?
Correct.
That's a separate one? And
Correct.
That's what you did on her?
And then the brow.
Okay. So the brow is a third procedure?
It would be a third procedure, right?
Okay. And what do? You do an incision up here? Or?
So there's the incisions in the temporal line, like we said, or over the muscles that we eat with. And then there's small little 1 or half centimeter, half-inch incisions in the hair, hair-bearing hair.
And so what are you doing? You excising skin up there, or are you tightening the muscles?
Well, so I'm lifting the brows. So what happens as we age, the brows come down, and we get that worried or tired look. So what a good brow lift will do is it will lift the brows up to a more comfortable position and kind of simulate what Botox, good Botox will do. Where the brows are just at the kind of where you can feel the bone of the eye. That's where you kind of want the eyebrows to be. So the brows will be in the right position, as opposed to the patient having to lift them up.
Yeah,
and that it makes them look more relaxed. You know, commonly I get from men. I don't know what it is, but when I look in the mirror, I look angry or worried.
Right.
And that's one thing that's not good as we get older. We don't look more
right.
worried. We also want to look younger, but worried is not good either.
No worries. No, Siggy looks great. Yeah. I mean, she said that you took 15 years off her look, and I think you really did. She looks fresh and doesn't look done. You know, she doesn't look like she had anything done, that's the real.
And that's
the real test.
And that's exactly. I tell patients all the time. I say my best work goes unnoticed.
Right.
Because good work is not something where you come up to someone and said, "Where'd you get your facelift done?"
Yeah, what'd you get done?
Just, you look really good.
Yeah.
What'd you do?
Right.
So oftentimes my best work goes unnoticed.
She's she's very good for you because she tells everyone. So so you do the faces, and what other kind of plastic surgery do you do? You do everything?
I'm board certified plastic surgeon, so I did if I ever had to basically toe. So breast surgery as well. Lots of redo breast surgeries.
Any new changes in that field? Anything new?
They have come up with such good implants nowadays for breast augmentation and breast lifts that they are lasting a lot longer.
So people don't have to get them. Now, I know I have girlfriends that tell me they harden up over time. Is that preventable now? Is there any new product that...
That can certainly happen. But the new ones now actually come with a warranty.
Oh, interesting.
They're so confident with the implants these days that they actually have extended warranties.
How long do they warranty them for?
It varies,
okay.
but they do have an added kind of warranty to prevent about the scarring, which is technical word is capsular contracture.
That's what makes them harden up.
So the implants are better these days.
Okay.
The liposuction is still a very popular procedure, even though cool sculpting is very popular. I think.
Well, now cool sculpting is non-invasive, right?
Correct.
Is it the same? Does it have the same result?
No. So cool sculpting freezes the fat and supposedly goes away. But I will tell you,
I find it difficult to believe that actually is effective.
It only works in about 70% of people, which is not good enough for me. When I have a procedure like liposuction that is 99%, satisfaction and what I suck out is what I suck out.
But now I've always heard that the fat comes back in different places. Is there any truth to that?
No.
Like take it out of your legs, it might come in.
Well, yes and
on
no.
Your back.
Yes and no. Your overall your shape stays the same, and so the fat cells that are there are still in circulation. So what liposuction does is it seems like God just threw some fat either on your saddlebags or on your flanks. So there's actually extra fat cells there. So as you diet, those fat cells shrink.
Okay.
With liposuction, we're taking those fat cells out of population, so they're gone. So if
you know what you want, and this fat's not going to come back in that spot.
Well, those fat cells will just kind of swell just like the other fat cells. So that's why it's, am I going to get fat cells in other areas? No. It's just the fat cells that are still there if you gain weight.
In other areas,
So
it just doesn't come back. I
it's
see
just
what you're saying.
the wrong explanation.
Yeah, I see what you're saying.
So the population of fat cells are redistributed.
Yeah. So you still have
That
to
doesn't-
diet and everything else. You can't just get your fat sucked out and
Yes,
think-
yes. Unfortunately, yes. We
and
do.
think
We do
you
still
solved the
stay in
problem.
shape, but your shape does maintain. So
Right.
the trouble
So-
areas in women,
so
saddlebags,
that can't
and
come
flanks.
back. They get this gone, it's not going to come back there.
Right.
That's interesting. Tell us, we have about 5 minutes left, but I want you to tell us about your practice, where it is, what,
Thank you.
Anything that people should know.
Yes. So the practice is in Delray Beach on Linton Boulevard. And we are excited about building a new office, which actually is going to be in Boca. We're about 100 yards north of the
Do you do your
Boca
surgeries
line.
in your office, or do you do them in the hospital?
I do both.
Okay.
Because
I think Siggy said she had it done in Delray Medical Center.
right. So I do surgery at Delray Medical Center as well as Boca Community.
Oh, I didn't know you were there.
Yeah.
Okay. That's probably where I've seen you.
And so today I was at Delray and we did a surgery. We did a mommy makeover. We were redoing breast, lifting breast, and
Mommy
lots
makeover.
of
What's involved in
liposuction.
a mommy makeover? That's
So we're lifting the breast.
okay.
And then tummy tuck.
Oh, interesting.
So we're reversing
Okay.
the signs of having babies.
Right. Oh, that's wonderful. So you do at Boca Community and
Delray Medical
Delray,
Center.
but your office is
Right.
on Linton Boulevard. Okay.
Right, and then so the local procedures that we're talking about, like the eyes or the facelifts,
The neck. What about that kind of
and
stuff?
and the neck lift I would do in the office.
In the office. Okay.
And I'm excited because we just closed in a new building that we're going to be building out in Boca Raton,
Oh, where is
across from Lynn University.
Oh, fantastic.
And so
On Military
excited
Drive?
about that. Correct.
Oh, that'd be a great location for you. That's
Right.
very well. Good thing you came on the show to tell
That's right.
us
So I'll
that.
be closer to you.
Yeah,
so,
yeah. I'll have you on as a guest again. So, okay. So, if somebody, how do you decide whether they go into the hospital for a surgery, or which hospital they go to, or whether you do it in the office? What's the criteria?
Patient preference. We accommodate the patients.
Is there any
needs.
advantage to doing it in a hospital versus an office, or vice versa?
Not as long as you have the right patient, right people, right place.
Yeah.
Some patients want to stay over the night,
Mm-hmm.
and so when that happens, we usually go to the hospital.
Okay.
In the new office that we're building, we're going to be able to keep patients overnight and do a little more surgeries there.
Oh, that's nice. So you do them right in that
Right.
facility. Okay. So for something like what Siggy had done, was that a stay overnight kind of thing?
She did. I don't remember if she stayed over, but most patients will go home nowadays.
Yeah, I know. I've talked to a lot of people.
A lot of patients, and most patients that I do surgery on are younger. You ask about my practice. I treat kids, teenagers, do rhinoplasties, and breast, asymmetry surgeries, and then I do patients in their 30s and 40s, which is mostly breast augmentation, neck lipo, neck lifts, eyelids, and then 50s and 60s facelifts and endoscopic facelifts, and of course any age is good for liposuction.
Right.
But I also do a lot of gynecomastia surgery as well in
On the men.
gentlemen, and that's kind of anywhere from those start in teenage years too.
Really?
The kids start getting made fun of and get bullied,
Right.
which I like to very rewarding patients because they're very thankful.
Yeah, I bet.
They don't want to take their shirts off. They don't
Right,
want to
and
go to
that's
the
a
beach.
very difficult. And in Florida.
Exactly.
Yeah, sure.
And then guys, as they get older, there's they start to get a little bit of extra fat, and then it goes to the breast, and so they don't like the way their
like
their
that.
golf shirts fit.
Sure, absolutely. Interesting. Okay, well, do you want to give your phone number in case anyone
So
wants to get a hold of you?
Our phone number is 561-495-2700, and that is the best way to get a hold of me and the practice to get information. We also have a website.
Okay, and what's your website called?
drgregoryalbert.com.
Okay.
But we love talking to patients. We like to educate, and the best way to get it quickly and as concisely is to talk to the office, and
So just calling it.
and
Yeah.
that is the best way to do it.
And do you have anything people can look at online, like befores and afters and things like that?
Absolutely. Our website is before and after pictures, and it's separated into men and women because I do cater to both men and women.
Okay.
So a man feels comfortable. They're not looking at female pictures, but for male
Right.
procedures, because quite frankly, they're approached differently.
Yeah.
So there are pictures on the website, and then we also go over them in the office. Every patient that has a consult, when we talk about procedures, sees pictures of patients that I've done surgery on, not stock.
To
Before
your
and
own
after
patients.
pictures. Correct.
The befores and afters, so they can see exactly
Right.
exactly what you've done.
Oh, I just want to add one thing.
Sure.
I also do a lot of arm lifts,
Oh, that's important.
which is probably a whole nother show because in
Yeah.
Florida, women are always sleeveless and they don't like their arms.
I know.
So I found
know.
a need.
That is,
and I do a
that's
lot
very
of-
important
I do
because
a
it's hard to
lot
wear
of
sleeves
arms.
in here in this kind of heat. So, okay,
That's
well, I'm
right.
going to have you back again sometime so you can tell us about that and your other procedures.
Perfect.
So, thank you very much. I think I have to switch out guests now, and you're off to a game, right?
Yes, I also treat the Florida Panthers and the Miami Dolphins. Tonight is a hockey game, so I suture the.
Oh, you do the Dolphins too.
Yes.
So you just kind of stand there on the sidelines, and if somebody gets injured,
For that, I'm on call. So
Okay.
so if they have a broken nose or a broken orbit and the broken facial bone, I'll fix that. And then I do the same for the hockey players, which have more likelihood of getting injured. They break their noses quite frequently, so I fix their noses.
wow.
But then during the games, I'll evaluate them, and usually about one a game, there's a laceration to the
yeah, I bet
to the
That's a rough-
face.
That's a rough sport.
Yes.
Okay. Thank you very
Thank you.
much, Dr. Albert, and I'll be in touch because I want to get you back on here, and you might want to get involved in some of the things that we're doing around town. We have more events.
Would love to.
So,
Thank
okay.
you.
Thank you.